patient is not going to act like so many patients we get. I don't think that's good training for students. If somebody's going to clutch their
Hmm.
pearls the first time a real patient snaps at them or swears at them, we're not doing anybody any favors. So I think that I might be able to have the
Hmm.
brusque meter be able to move up or down as I'm trying to build a scenario or not knowing what's going to happen. But there are times when I think if you want this to be real world, it's going to have to be able to do those things.
You just mentioned something, and in terms of guardrails and compliance, that I think is really fascinating. It is something that I have heard anecdotally and numerous times, which is that a lot of these the guardrails that are put in place by Google and OpenAI are intended for safety purposes to prevent things like the proliferation of racism or reduction in diversity, equity, and inclusion, and kind of like this AI that is abusive or inappropriate and curses. And we operate as professionals in healthcare in this kind of in between world
Hmm.
where, I mean, when I was in the emergency department, 90% of the people there were having the worst day of their life and they were not pleased
Absolutely.
about it. And it was completely understandable that they
Yes.
were upset. And, you know, the gloves are off. They sometimes they say some nasty things. And that's not even the mental health case patients. When you have a mental health patient,
That's right.
they have a chemical imbalance in their brain. The gloves have been off since day one, and
Right.
they are definitely not going to say nice things to you. And so, the anecdote that I have to share, and maybe people listening to this have experienced it themselves, where because some companies are just using the legacy models, the big OpenAI model, and um, whatever guardrails come with it, as kind of like, oh, we trust OpenAI and their guardrails, and so we'll just use those.